à tous. Good morning, everyone. Before I get started, I want to speak very quickly about the call I had earlier this morning with President Zelensky of Ukraine. The President and I discussed our shared concerns about recent Russian military activity and ongoing aggression in the Donbass and in Crimea. On our call, I reaffirmed Canada's unwavering support and friendship for Ukraine's sovereignty and territorial integrity, as well as our commitment to further deepening our long-standing friendship with Ukraine.
For many people, the long weekend was an opportunity to organize family Zoom meetings or to spend time outside. But it was not a holiday for everyone. In the four corners of the country, nurses, doctors, contact tracers, and public health staff members were at work. They are there to make sure that we are safe, and we must do same for them. What they're telling us, and also confirmed by all modeling, is that the situation is very disturbing.
Countries are facing a very serious third wave of this pandemic, and right now, so is Canada. This isn't the news any of us wanted, but hospitalizations are surging. ICU beds are filling up, variants are spreading, and even people who had convinced themselves they didn't need to be concerned are getting sick. Even if the sun is shining and the weather is getting warmer, COVID-19 isn't done with us yet. And that means we all have to hold tight a little longer. Later today, I'll speak to Premier Ford about the situation in Ontario. I know we'll talk about what the spike in cases means for hospitals and the importance of vaccinating as many people as possible as quickly as possible. We'll continue working together to keep Ontarians safe and support people and businesses through this next wave. On that note, I'll also be speaking to all premiers tomorrow about our continued and shared work to protect and support all Canadians right across the country. Tant qu'on n'aura pas vacciné.
For as long as we've not vaccinated the most people possible, we must continue protecting one another by respecting public health guidelines. Almost everywhere, depending on the increase or decrease in case numbers, rules would be adjusted. Ontario, British Columbia, and Quebec have already made a difficult but necessary choice to take stricter measures to stop the surge of COVID cases. This is not easy, and we know that the measures may become even stricter, but that is what is necessary. We are doing this to save lives.
Flatten the curve to save lives. To young people, you've made tremendous sacrifices over the past year to protect your parents, grandparents, and the heroes on the front lines. Thank you. You are saving lives. We need you to keep doing this a while longer. If you can stay home, please do. And to frontline workers, I know you're tired, exhausted. I know you're really scared about what the coming weeks could bring because you're seeing the seriousness of these new variants and the spike in cases. You have done an unbelievable job over the past year. Know that we will continue to be there for you, and we will get through this together. If you need to take time off because you're sick or self-isolating, we've made sure the Canada Recovery Sickness Benefit is still there for you and any worker who needs it. In fact, we've added 2 more weeks to that benefit. Go to canada.ca to see how you can qualify because no one should be going to work sick right now. Of course, if you need PPE on the job, we're continuing to get you that. And above all, we're working around the clock to get vaccines delivered.
You probably know people who've received their first dose, or maybe you have received your first dose yourself. You therefore know that each dose counts. We've already delivered more than 10 million doses of vaccines to the provinces and territories. Not only have we achieved our target for March, we have exceeded those targets extensively. And from now, doses will increase even more quickly. This month and next month, we will receive more than 1 million doses per week from Pfizer alone, in addition to the deliveries from Moderna and AstraZeneca. Later this month, Janssen will also start delivering its vaccine to Canada. And as I said last week, Pfizer has confirmed that they will send 5 million doses in June earlier. These doses were slated for the late summer, but will receive them now earlier. Minister Annan and her team, as well as the Public Health Agency of Canada, are working tirelessly to coordinate deliveries, and we are doing everything to make sure that vaccines are administered as quickly as possible.
Bring over 1 million doses a week to the provinces and territories. And we'll keep making sure these vaccines get to people as quickly as possible. As Deputy Prime Minister Freeland announced, we're providing additional support to the provinces and territories for their pressing needs on vaccine rollout. The federal government has paid for the vaccines, and we're happy to continue to help with more resources as needed. Because this is no time to go back and forth over who should pay for what. This is the time to do everything we can together to get as many people vaccinated as soon as possible. From day one, beating COVID-19 has been a Team Canada effort. Last summer, we delivered $19 billion through the Safe Restart Agreement to support the provinces and territories on what Canadians needed to get through this crisis. That money has helped with everything from additional staff at seniors' homes in Alberta, to modeling in BC to help keep communities safe, to mobile testing in Nova Scotia to reach rural areas. Today, we're delivering on the final installment for that Safe Restart Agreement. Our priority is for funding to go where it's needed most, whether it's for patients in hospitals, PPE for essential workers, or COVID-19 testing and screening for people on the front lines. Tout comme le premier versement.
Just like the first investment, the $700 million investment announced today under the Safe Restart Agreement will help ensure the safety of people and help families and small businesses overcome this pandemic. The money invested in Canada to fight this pandemic, $8 of the $10 comes from the federal government. We want to help people overcome the crisis and make sure that our country is well positioned to build back better.
Before I end this morning, I want to take a moment to recognize that this will be an especially difficult day for a lot of people. It's now been 3 years since the terrible Humboldt Broncos crash. Today, we remember 16 people taken from us much too soon. And as we do, we stand with the families, friends, and teammates whose lives were changed forever. To people grieving across the country, we're thinking of you. I can only imagine how hard it is for you not to be able to gather on this day. And to everyone who continues to recover and rebuild, your strength is remarkable. Every day, all Canadians stand with you. Merci.
Thank you. I'll now give the floor to Dr. Tam. Teresa.
Bonjour à toutes et à tous.
Good morning, everyone.
1 million cases of COVID-19, including over 23,000 deaths, were reported since the start of the pandemic in Canada. And this is a stark reminder of how much we've been through. With more contagious variants driving epidemic growth in many areas of Canada, we know this virus is not going out with a whimper. But our vaccine response is getting stronger every day, and we will get through this pandemic together. Just yesterday, we marked the milestone of delivering 10 million COVID-19 vaccines to provinces and territories. Over the past week, on average, there have been almost 6,100 new cases and 31 deaths reported daily. With an ongoing increase in severe and critical illnesses placing a heavy strain on the health system in many places, it is clear that community-based restrictions will be needed a while longer. Last week, an average of almost 2,400 people with COVID-19 were being treated in our hospitals each day, representing a 4% increase over the previous week. This includes over 780 people in intensive care units, which is a weekly increase of 18%. With increasing rates of infection, we are seeing a greater number of younger adults with COVID-19 being treated in hospital. This is a reminder that COVID-19 can impact people of all ages, and severe illness can occur at any age. Variants of concern are contributing to the current resurgence. The B.1.1.7 variant is known to cause more severe illness and increase the risk of death. Of the over 15,000 variants of concern cases reported to date across Canada, the B.1.1.7 variant continues to account for over 90% and has likely replaced the original virus in some locations. A significant increase in the number of cases of the P1 variant is also cause for concern. Cases due to this variant rose from about 460 cases a week ago to now 857 cases reported in Canada, with the majority of these reported by British Columbia and Ontario to date. Early evidence suggests that the P1 variant may reduce the effectiveness of vaccines, making it even more important to control its spread. With variants of concern posing new challenges in different locations across the country, now is not the time to travel across the regions for recreational reasons. Limit your travel to essential trips only to do your part to stop spread. Tomorrow marks World Health Day, bringing attention to a specific health concern common to many people around the world. This year's theme, Building a Fairer, Healthier World, serves to remind us of the inequitable impact that COVID-19 has had for many people in Canada and around the world. It also challenges us to ensure that our pandemic response prioritizes interventions that will support good health and safe recovery. Building in actions to address inequities in our response makes us stronger and more united. I know that we're all tired and looking forward for a break, but now is not the time to let down our guard or travel for recreational purposes. Please continue to follow local public health recommendations, stick to the safer habits we've learned, and get a vaccine when it's your turn. The bottom line is no one is protected until everyone is protected. Thank you.
Bonjour à toutes et à tous.
Good morning, everyone. Over 1 million cases of COVID-19, including over 23,000 deaths reported since the start of the pandemic in Canada, is a stark reminder of how much we've been through. With more contagious variants driving epidemic growth in many areas of Canada, we know this virus is not going out with a whimper. But our vaccine response is getting stronger every day, and we will get through this pandemic together. Just yesterday, we marked the milestone of delivering 10 million COVID-19 vaccines to provinces and territories. Over the past week, on average, there have been almost 6,100 new cases and 31 deaths reported daily, with an ongoing increase in severe and critical illnesses, placing a heavy strain on the health system in many places. It is clear community-based restrictions will be needed a while longer. Last week, an average of almost... There is an internet problem with Dr. No. Interpretation will resume when the sound resumes.
Okay, while we wait for the technical issues with Dr. New, let's open the questions for media.
Nous rappelle que la COVID-19 peut toucher des personnes.
COVID-19 can affect people of all ages, and people of every age can be severely ill. variants of concern are contributing to the current resurgence. The B variant is known to cause many severe illness and increase the risk of death. Of the over 15,000 variants of concern cases reported to date across Canada, the B117 variant continues to account for over 90% and has likely replaced the original virus in many locations. A significant increase in the number of cases of the P1 variant is also cause for concern. Cases due to this variant rose from about 460 cases a week ago to now 857 cases reported in Canada, with the majority of these cases reported by British Columbia and Ontario to date. Early evidence suggests the P1 variant may reduce the effectiveness of vaccines, making it even more important to control its spread. With variants of concern posing new challenges in different locations across the country, now is not the time to travel across regions for recreational reasons. Limit your travel to essential trips only to do your part to stop spread. Tomorrow marks World Health Day, bringing attention to a specific health concern common to many people around the world. This year's theme, Building a Fairer, Healthier World, serves to remind us of the inequitable impact that COVID-19 has had for many people in Canada and across the world. It also challenges us to ensure that our pandemic response prioritizes interventions that will support good health and safe recovery. Building in actions to address inequities in our response makes us stronger and more united. I know that we are all tired and looking for a break, but now is not the time to let down our guard. Please continue to follow local public health recommendations. Stick to the safer habits we've learned and get a vaccine when it is your turn. The bottom line is no one is protected until everyone is protected. Thank you.
Dr. New, we'll now turn to questions from media. We'll start on the phone. One question, one follow-up. Operator.
Thank you. Merci. Please do not hesitate to press star 1 on your device's keypad. N'hésitez pas à faire étoile 1 sur votre appareil. Première question, Marie Vastel, Le Devoir.
Question, Marie Vastel, Le Devoir. Good morning. Can you hear me? I am getting an echo. My question is for you, Mr. Trudeau. Maybe Minister Haidu may want to add. I would like to know what you have arrived at when it comes to the vaccine passport. In the United States, the CDC has changed its regulations recently for travel, saying that people who have not been completely vaccinated will still be at risk. There's lots of problems at the borders. We have family members who've been separated and also businesses. So do you intend to relax the rules for those who are completely vaccinated, particularly for the United States, so that maybe vaccines should proceed quickly at the border? Answer. Thank you very much for your question. Many people are thinking of what they can do this summer, thinking about trips and family visits, but we are not yet there. We are still in the middle of a very serious third wave. People must be very careful in the upcoming weeks for us to flatten the curve. That is the main priority. Of course, we all hope to be able to reopen the borders so we can start traveling in the coming months. We shall continue working with our partners in the United States and elsewhere in the world to make sure that that is done the right way. We have already seen the importance of vaccines for international travel before the pandemic. It's going to be important, but When it comes to the details of what we've done, we are still working on them. But of course, as you said, it's not right away. We are going through a third wave, and we must continue hanging in there for a few more weeks so that we can really flatten the curve and allow that the vaccines that will arrive in millions in the coming weeks have an effect. Patty.
Well, thank you very much. And the Prime Minister is absolutely right. Now is not the time for Canadians to be thinking about traveling as we worked so hard to flatten the curve. And we, thank the many, many Canadians who are sacrificing in ways that we see, in ways that we don't see. I'll just say that on the topic of vaccine passports for international travel, of course, we remain committed to having those conversations with our international partners, because however that conversation evolves, we want to make sure that Canadians have the right kinds of documentation for future travel.
Ms. Marie?
Oui, merci.
Thank you. I understand that it's not something that will be done tomorrow, but in other countries, progress has been made with vaccines. It's not really time for Canadians to travel, but some people have received 2 doses of the vaccine elsewhere and may want to come back here for business reasons or for personal reasons. Are you making progress on that front? Are rules going to be relaxed for people who want to come here if they are completely vaccinated? What do you intend to do with people who were vaccinated with a vaccine not approved in Canada? If people receive, for example, the Chinese or Russian vaccine elsewhere, these vaccines are not recognized in Canada. Will that be accepted as proof of vaccination when they come here? Answer. That's a very good question. The reality is we will rely on evidence at every stage. We will continue looking at studies. We will continue working together with our partners like the United States, who may take some measures before us, but we will make sure that we do what is necessary to protect Canadians at every stage. We continue monitoring evidence, and we continue listening to public health experts to find out what measures are appropriate for people who are vaccinated and those who may have been vaccinated by vaccines that are not approved. So we'll continue relying on them.
Thank you. Merci. Next question, Kate Bolingaro, Bloomberg. Line open.
Hi, Prime Minister. My question is for you. I am wondering, what does Janet Yellen's push for a harmonized corporate tax rate mean for Canada?
Well, I think we're all looking forward to conversations at the G7, at the G20 in the coming months with the international financial institutions about how we're going to not just get through this crisis and come back stronger everywhere, but how we can ensure that our international financial systems and institutions are the right ones for the coming decades. I think there's a lot of lessons that we've learned from this pandemic that we're going to be able to talk about all together, and we'll be open to hearing various proposals on how to make sure that growth is inclusive, that opportunities are there for everyone around the world. Canada will always look to ensure that we are competitive with other countries around the world in terms of taxes.
No follow-up, Kate?
And President Biden is urging the U.S. to open the vaccines for all citizens on April 19th. And what is your comparable date for Canadians?
As I've said, we intend to have every Canadian fully vaccinated who wants one by the end of the summer. We have passed our milestone that we'd promised for the end of March of having 6 million vaccines. As you've just heard, we're actually over 10 million vaccines delivered. So we're doing well, but there's a lot more to go. The tentative numbers we have out is we're optimistic about having more than 44 million doses of vaccines arrived in Canada by the end of June. Various provinces will do the math differently, will sequence different populations, as is right, with different postures in this disease across the country. Our job as a federal government is to work every single day to get more doses to this country as quickly as possible. This past week was a record week, but we're looking forward to getting even more in the coming weeks. That's what Minister Anand and her entire team are working on every single day. We know getting as many vaccines as possible, as quickly as possible, is the way we get through this as rapidly as we can.
Thank you. And we'll take one more question on the phone. Operator.
Thank you. Merci. Prochaine question, Philippe Vincent Foisy, Radio-Canada.
Question, Radio-Canada. Good day, Mr. Trudeau. I have a question on vaccines. You are saying that all is well when it comes to vaccine deliveries, but when we look at what happened during the weekend, even your health minister said millions of doses were sent to the provinces and they are the cause of delays. And when people ask, why have I not been vaccinated in spite of all the millions of doses that have been delivered? And you say it's the fault of the provinces. Is that really the heart of the problem? Answer. People have seen that we have delivered a significant number of vaccine doses over the past weeks, and we shall continue to do so. That is the responsibility of the federal government. Obtain doses from abroad, pay for those doses, and send them to the provinces. But of course, as you have stated, we shall be there to help the provinces to administer them as quickly as possible if they need our help. Follow-up question? Yes. What does it mean concretely? When you talk about help them administer the vaccines, what does that statement mean? People are hearing you talk of millions of doses, but they are not vaccinated. Answer. I think people recognize the fact that we must all speed up the vaccination process, and that is done when we have deliveries. For example, we have 1 million doses coming in from Pfizer per week in the coming weeks. Lots of doses will be coming on from Moderna, AstraZeneca, and very soon Janssen will also start delivering to Canada. So we shall continue doing our job to make sure that more and more doses are delivered throughout the country. But if the provinces need additional resources, additional assistance, we shall be there with those resources to make sure that those vaccines are administered as quickly as possible.
Oliver with CTV National News. It's been reported that there will soon be about 90 million doses of AstraZeneca sitting unused in the United States because the FDA has not yet approved AstraZeneca. Do you think it's right that the Americans are sitting on tens of millions of vaccines they can't use? And do you intend on asking President Biden for some of these doses to be delivered to Canada immediately?
We have continued to engage in conversations with partners around the world, including the United States, about getting more doses quickly. We recognize that the United States has actually already sent us 1.5 million doses of AstraZeneca, which arrived last week, and are looking at ensuring that their closest partners and neighbors, for economic reasons and for reasons of family and proximity, get vaccinated as quickly as possible. We continue in those conversations with them, and we're hopeful that we'll all be able to get through this quickly.
CBC, you're talking about the federal government potentially helping the provinces get more vaccines out. I'm wondering specifically, do you envision federal vaccine clinics? Like, what specifically can the government do to make sure more vaccines get out faster?
Well, for example, from the very beginning, we've been present in remote and northern Indigenous communities to help with vaccination efforts for the most vulnerable. That was part of our strategy from the very beginning, to recognize that in Arctic communities and northern and remote communities, we needed to take special measures to not go in back repeatedly for every time we drop the ages by 5 years, as the rest of the country has done, that we were just going to vaccinate over 75% of those northern or remote communities once, so that we're able to protect people. And those are the kinds of things that the federal government is doing. We have handled and been there to support the logistical rollout of vaccines and distribution across the country. And as provinces have asked for extra help, whether it's extra resources, extra medical personnel, or logistical support staff, we have been there to respond to them. The provinces in general have been very clear that they feel that the vaccination is something that they are able to handle on their own. But as always, we have a Team Canada approach. And if anyone needs extra help, the federal government will be there, as we have from the very beginning, whether it's on vaccinations, whether it's on contact tracing and rapid testing. We sent tens of millions of rapid tests to the provinces in the fall. We're continuing to work with them on getting them rolled out, whether it's on direct support for businesses, for communities, for individuals, for families, for seniors, for youth people. The federal government has stepped up with 8 out of every $10 spent on recovery and support during this pandemic coming from the federal government. We will continue to be there to make it through this final wave, hopefully, as rapidly and as effectively as possible. Depuis les tout débuts.
From the very beginning, the federal government has been there to help provinces overcome the pandemic. We still respect the jurisdictions of provinces. Some provinces said they did not need our help for vaccines to be administered to patients, but we shall of course be there to continue providing support where needed, just as we did in rural and northern communities. And as we will continue to do with contact tracing, rapid testing, direct support to small businesses, health systems, families, and workers. We've been there right from the very beginning to help, and we shall continue being there once the provinces so request. But our priority is to make sure that the greatest number of vaccines possible are delivered as quickly as possible, and that is exactly what we're doing. Last week, we beat all records for vaccines delivered, but we know that there's still a lot of work to do, and we shall continue delivering those vaccines.
Premier, later on today. Ontario and Ottawa have been pointing fingers at each other in terms of supply of vaccine, distribution of vaccine. I'm just wondering, not just Ontario, other provinces as well. So how do you say there's a Team Canada approach to this when there's this level of sniping between the levels of government?
Well, I think we're in a situation where everyone is exhausted, not just families, workers, small businesses, frontline workers, but also leaders. This has been a very, very long year. And as a federal government, we've not engaged in pointing fingers or laying blame or judging. We're not going to do that. We are there to help. I made a simple promise way back in the beginning of this pandemic that we would have people's backs. And that's what we've done. Have we done everything perfect? No, of course not. But are we continuing to work hard every single day to get more vaccines into the country and to support provinces and territories on delivering those vaccines? Of investing in contact tracing, in rapid testing, in supports for families, in this sickness benefit, for example, that we're announcing is renewed by 2 more weeks so that people don't face impossible choices about going to work and risking infecting your neighbors or putting food on the table. We have been there every step of the way to support the Team Canada approach, and we will continue to.
Answer repeated in French. From the very beginning, the federal government made a simple choice to be there for Canadians for as long as possible with all the resources that will be required. And that is exactly what we did. Be it with the delivery of vaccines from abroad, partnerships with the provinces on testing, contact tracing, investments like the Restart Fund. We shall continue being there. Understand that people are tired. People are exhausted, be it first-line workers, families, seniors, young people, even the leaders themselves. It is not easy, this pandemic. And I understand that it can sometimes be frustrating, But as a federal government, we have been there for people, we have been there for the provinces and territories, and we shall continue being there by doing all we can to deliver the greatest number of vaccines as quickly as possible to be able to overcome together.
Hi, Prime Minister. With more younger people getting more seriously ill, as you know, that's prompting a push, especially in Ontario, to prioritize essential workers. Understanding that those vaccination decisions are up to the provinces, what do you think needs to change about the rollout? And will you be asking Premier Ford on your call today to prioritize essential workers?
I look forward to speaking with Premier Ford this afternoon and offering whatever support I can offer. We know that the situation is serious, not just in Ontario, but right across the country, and different jurisdictions are making the decisions that they feel are appropriate for them to keep people safe, to get through this as quickly as possible. And I'm going to check in with him to see what we can offer as a federal government to help get Ontarians and indeed all Canadians through this as quickly as possible.
And on essential workers, there are calls still growing louder for guaranteed sick leave. I understand that you've extended the recovery benefit, but are there talks underway at the federal level for guaranteed sick leave as separate from the benefit?
We brought in a 2-week sick benefit, recovery benefit to ensure that anyone who comes down with a sniffle or symptoms or has to self-isolate is able to stay home and not worry about being able to pay the rent or put food on the table. That was an initiative that the federal government went forward with, and given this third wave, we've extended it by another 2 weeks, so that's available for people. And if you want to find out how to apply for it, just go online to canada.ca, and you'll be able to canada.gc.ca, and you'll be able to figure out how you can apply for it, because we want people to understand that even during this third wave, the federal government will continue to be there to support them. Now, a number of provinces have moved forward as well with complementary measures, and I encourage people to look into the supports that they can get as well. We need to hold on. We need to hang in there to get through this third wave by holding tight and looking out for each other and flattening this curve. And everything we can do as a federal government, everything we can help the provinces do is going to help us get through this with one last push.
Good afternoon, Mr. Trudeau. Mana Hamidi with the Canadian Press. What's your reaction to the charges in Iran on the tragic airliner shoot-down? Do you trust the justice system in Iran to deliver justice to the families of the victims?
We are tremendously concerned about the lack of accountability that Iran continues to have on this issue. The lack of transparency, the lack of a full and total investigation means that Canada, along with our fellow countries in the International Contact Group, will continue to put pressure on Iran to deliver true accountability and justice, compensation for the families. I spoke this morning with President Zelensky about the ongoing criminal trial and got an update on that. We will continue to work with the international community, work to reform international aviation standards, and mostly work to make sure that the families that I had the opportunity to meet with and sit down with, who continue to be heartbroken and will for the rest of their lives on the losses of these loved ones, get closure, get compensation, and mostly get justice from Iran.
Thank you. That concludes the time the Prime Minister has. The doctors and ministers will still be around for questions in just a moment. So we'll go back to the phone for questions. Operator?
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, this question's for Minister Hajdú. I'm wondering, the Conservative leader, Mr. O'Toole, today called for a post-pandemic public inquiry to examine the government's actions throughout the inquiry. I'm wondering what you make of that. I know you suggested there would be some kind of review after the pandemic is over. Do you think a public inquiry is the right forum for that?
Well, thank you very much, Ryan. And I think the Prime Minister and I have both said that every country should do a full review of their pandemic response when we are through this crisis. Clearly, every country has a lot to learn, including Canada, and we have committed to that. And so, obviously, from our perspective, there needs to be a foundation so that we have a full accounting of the lessons learned through this pandemic that can be applied to better preparedness for the next global health crisis.
Follow up, Ryan?
Yeah, I know there have been reports coming out of a few cities about vaccine appointments going unfulfilled, and there's still some people who aren't, at least not rushing out to get a vaccine when they're eligible. I'm wondering if you're looking to do something to address that hesitancy and maybe also give people an idea of what parts of their normal life they can return to by getting the vaccine that might incentivize them to come out and get it.
Thanks very much. It's a great question. And yes, we have had our minds wrapped around vaccine hesitancy for quite some time. In fact, we launched a call for proposals to community organizations and other groups that can work within, for example, specific cultural groups or faith groups to apply for money to disseminate information in culturally appropriate ways. It's a $53 million fund. And I encourage a variety of different community groups to check out the availability of that money that can help them with disseminating information to populations that may prefer to get information in different ways and in different languages. We also have ongoing messaging to Canadians about the benefit of vaccination, and we'll continue to do that and evolve our messaging as the vaccination campaign evolves. And then finally, yes, I think the Prime Minister referenced this in a question earlier around vaccine passports and what can you do when you're vaccinated. We're working on materials. Of course, those materials will evolve as the evidence and research evolves. I know Dr. Tam has spoken about this a lot, and maybe I'll turn it over to her to speak a little bit about what we're still learning through research about onward transmission from people that are vaccinated. Dr. Tam?
Yes, I think in the area of vaccine confidence, that besides the delivery of lots of vaccines, that is going to be the key area of focus, I think, for work for the whole of the public health system in Canada. And I think the really criticality, as Minister Hadley said, is that it's not just the broad messaging, but the more targeted approach to different communities. I've been fortunate to be able to participate in a number of those sessions. Been very impressed, for example, for Black physicians, and in partnership with Black North, for example, business leaders are able to outreach to their communities. And that's some of the most effective ways of doing that. Business leaders, as well as faith leaders and health workers, who can reach out to those communities because they have a trusted voice. I think our role is to provide them with information on the effectiveness, the incredible effectiveness of these vaccines in preventing serious outcomes and deaths. So for any individual, that's the key message, is that it stops you from experiencing severe outcomes. And even though, of course, the most severe outcomes are in older age groups, as we've seen even in younger populations, while still relatively rare, as numbers increase, you might be the one that is going to have a significant illness. So that is really important even for the younger population, where I think vaccine confidence is not as high as we would like, because there's a perceived perception that they're less at risk, of course. So I think this current third wave with the variants thrown in is really important message that at any age group could potentially have a serious outcome. And that is the primary reason for getting vaccine. That is the benefit you're going to get. And then the other message is that really the vaccine is there for individuals to protect each other. No vaccine is 100% effective. Even a 90% effective vaccine still leaves 10 out of 100 people who are vaccinated who may not be protected. So you depend on other people getting vaccinated to protect each other. And some people can never get the vaccine or will never mount a sufficient immune response to it. So getting as many people vaccinated as possible is the strategy, and particularly at the time when the variants, when the pandemic is escalating in Canada. So I think that's what's to focus on, is what the vaccines will do is help us, together with public health measures, get this third wave under control. So I think that's the focus. Of course, beyond that, depending on your epidemiology, which is different in different parts of Canada, whether you're in Newfoundland versus in Toronto right now, you will be able to undertake increasing different types of social interactions, both as a result of the success of your public health measures and vaccinations. So it is a difficult period. I think what our message is, focus on protecting each other as well as protecting yourself from severe outcomes.
Thank you, Doctor. Prochaine question, operator.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne.
Catherine Lévesque, La Presse canadienne. Question. Good afternoon, everyone. My question is for the doctors. You said in your introductory remarks that the vaccine will be less effective against one of the variants. Could you give us more details on the fact that P1 is more resistant to the vaccine, the COVID-19 vaccine? Thank you for the question. This is Dr. No. Let me start. It's true that people who've taken Pfizer and Moderna, well, all the manufacturers are continuing evaluations in their laboratories against the virus, including the variants, to see if the vaccines are still effective. To date, most of the variants are responding to the vaccine, but it's something to be monitored. We know from experiences elsewhere, like South Africa, that some of the variants are not, that the vaccine is not as effective against some of the variants. But this is a situation that continues to evolve. And with the evidence that we have, analysis are still underway. So we would like to say that it's very important. Vaccines are not a miracle solution. We need to continue with respecting all public health guidelines. It's not all about vaccines, so it's something that has to be monitored for now. Thank you. Follow-up question, Catherine? Yes. We write articles, and now we are informing Canadians so that they can know what is going on. What is the real situation? So I would like to have more details.
To jump on this, because we have Canada's top doctors telling us that one of the variants actually spreading and multiplying in Canada is actually resistant to the vaccine. So I was kind of wondering what was your message to Canadians right now, and also relating to travel. Should Canadians not go to BC because the variant P1 is multiplying there? Maybe if you could just kind of recenter the message around that and tell us what's the situation about P1. Thank you.
Do you want me to start?
Well, I could start too. This is Teresa Tam. I'll talk a little bit about this. So I actually, the Chief Medical Officers of Health had regrouped just to discuss the evolving situation with the P1 variant, including the clusters in British Columbia, Whistler as well, and some of the news that you would have heard about some of the clusters in Alberta. and we're also discussed with Ontario and other jurisdictions in increasing their gathering of information on this particular P1, but also doubling down on being really careful with case contact management, testing of contacts, double testing of contacts, chasing contacts of contacts to try and, as much as possible, slow down and reduce the spread of this virus. We said in our introductory remarks, Dr. New and I, after discussing with the chief medical officers, that now is not the time to travel for recreational purposes. We were concerned that, for example, if different people from different provinces ended up at a ski resort, that there are variants in those settings, that there's a potential for spread within Canada between provinces. So I think it's a very clear message that do not travel for recreational purposes outside your own, locality. Right now, that's really important. So secondly, in terms of why the P1 variant is important, we're still gathering information, as Dr. New says. There's still a level of uncertainty about whether this P1 variant causes more severe illness or not. They're not seeing that necessarily in BC. That is increased severity, but with increased numbers, they are seeing more people being hospitalized or going to the ICU. They are younger people because that's the population that were infected, the demographics. And so I think the message is P1 or other variants could infect younger populations and could cause severe illness. So do not be complacent, and we'll try and use different messaging for the younger population. Thirdly is that we don't have enough information from other countries, including Brazil, about how well these vaccines work against P1. There are only mainly laboratory antibody studies, which shows in some of them some reduced ability of the antibodies from a vaccinee to neutralize this P1 virus, which is a signal of concern. There's a mutation called E484K within this virus, which scientists think is possibly renders the virus to escape the current immune response, including the possibility for someone to be reinfected. That was the initial event that caused us to be concerned about this P1, is that there was a reinfection in a particular person that already had COVID-19 before and then got reinfected. That tells us that this virus might be capable of evading that immune response, but we do not have an actual vaccine effectiveness estimate that is solidified in terms of the evidence. And if Canada is seeing the evolution of spread of P1, we might be a country where we will be able to produce some of this data. And I also discussed with the chief medical officers that we need to look towards their leadership in gathering that information.
It's Dr. New. Maybe before I pass it to Mr. Haidu, I'll just outline three main points, exactly like Dr. Tam said. Number one, I think everyone on an individual level needs to take personal responsibility to the extent that's possible. We recognize there's issues, obviously, with essential workers and so on, but really, the personal protective measures that stay at home as much as possible, don't have sort of non-essential travel, especially vacations going from one province to another. So that's at a personal level. The second point is that what governments and local authorities can do in terms of closing stores, lockdowns, etc., and so on. Certainly that's been in the news, and I certainly local authorities, I think, have a best understanding of what could or should be done, and we'll let that play out in terms of what provinces do in their own sort of situation. And then thirdly, of course, the vaccines. I think at the present time, everyone, I think, as soon as you get offered one of the approved vaccines in Canada, we all wait our turn, go get vaccinated. So all those things together, the personal protective measures, measures that the authorities can put in place at sort of at a population level, and then the vaccination, I think, is the way that we're going to, hopefully, I can say, get out of this sooner rather than later. Thank you.
Yeah, but sorry, if I may, so do we have proof that P1 is more resistant to vaccines? That's ultimately my question. It seems like you don't have any proof right now, what you're saying.
Yeah, it's Teresa Tam. No, it's just laboratory signals in, that the antibodies from vaccinees don't neutralize this virus as well. But that's the only clue we have. We don't have great information, but do get vaccinated because there is no black and white turn on and off switch. There will be some level of protection. So still get the vaccine.
Hi, it's Patty Heidi speaking. Maybe I can just add a little bit here. I will just emphasize, I think the 3 points that Dr. New made are very, very important to remember, that in fact what protects Canadians against the variants is less COVID, and less COVID depends on all of our actions. Canadians have sacrificed, as I've said before, as we've all said, tremendously over the last year and a bit, and the choices that provinces and territories are making now will determine how much more we all Canadians have to sacrifice as we get through this pandemic together. So it's personal decisions, it's the choices that provinces and territories are making, and of course those are the kinds of things that will slow down or in some cases accelerate spread that will put Canadians at risk or protect their health.
Thank you, Minister. Next question, operator.
Thank you. Merci. Next question, Marika Walsh, the Open.
Hi, thank you so much for taking my question. My first one is for Minister Haidu. Your tweets last night seemed to be suggesting that you take issue with the speed at which the provinces and territories are rolling out the shots that they're receiving. Can you please clarify what pace you expect the provinces to be following? So how many days should it take from the time they receive the shots for those shots to be administered?
To be clear, Marika, the tweets last night were providing information that we post online in a more accessible format for Canadians, given how much conversation there is about provinces' doses received and doses administered. So it was a series of tweets that highlighted the number of doses that have been shipped to provinces and territories, the number of doses that have been administered by the date of that tweet, and a link to where Canadians can get information about their own provincial vaccination strategy. Obviously, everybody is anxious to get vaccinated. In some jurisdictions, in some provinces and territories, there's a high degree of confusion and concern, and so this information is presented to Canadians so that they have the facts as they try to figure out when their turn will come for vaccination.
Follow up, Marika?
Okay, that was not my question. My question is, how quickly does the federal government expect provinces to roll out vaccines? If vaccines are delivered on Monday evening or Monday during the day, how many days should it take for provinces and territories to administer those vaccines?
I think the Prime Minister was clear that if any province or territory is having challenges in administering vaccines that they're receiving,
my question is very specific.
Well, of course, provinces and territories are going to be administering vaccines as they get them. Our expectation is that they work as diligently as possible to get them out as quickly as possible. I think that's what Canadians' expectations are. Each province and territory has a slightly different strategy. We'll be providing data to Canadians as we have all along, so that Canadians, no matter which province or territory they live in, can understand how many vaccines at any given time a province has received, how many have been administered, and where to get that information about when their time will come.
Thank you. Next question on the phone, last one on the phone, operator.
Thank you. Merci. Next question is from Tonda McCharles, the Toronto Star. Line open.
Yes, hi. Thanks for taking my question. Minister Haidu and perhaps Dr. Tam, can you address what is Health Canada and the Public Health Agency of Canada's plan right now for the border reopening? What metrics are you looking at in order for the country to make a decision about when the border should reopen?
maybe I can start. And I will just say that clearly now is not the time to consider international travel. And we monitor a number of different metrics, including domestic spread and provinces and territories' capacity to manage cases in their own jurisdiction, as well as the situation internationally. Clearly, we find ourselves in the middle of a third wave for many countries around the world. We have global vaccination rates that are very disparate across the world, and of course, domestically, we see a number of provinces and territories that are struggling with increased caseload. So I'll just repeat that now is not the time to consider international travel.
And a follow-up?
Dr. Tam, are you able to weigh in? Yeah, I have a follow-up, but I had also asked Dr. Tam to respond. So I'll once I hear her answer, I'll ask my follow-up.
Of course.
Yes, hello. It's Teresa Tam here. So I think Minister Hadu's outlined some of those considerations. One is what is the domestic situation. One is what's going on outside of Canada in terms of epidemiology and spread. And the other aspects is, of course, whether the provinces are coping with hospitalizations, ICUs, that kind of capacity. So we must be able to cope with any potential risks. And I think that's, absolutely critical. There are, of course, other considerations, whether it's operational or otherwise, that always needs to be taken into account. Right now, of course, we have put in place testing capacities and other capacities to enable the safe entry and quarantining of travelers. And so it's not just the public health rationale, but also what that operational elements might look like. So all of that has to be pulled together for our decision makers to take up that decision.
Okay, thank you. So I didn't hear in that metrics such as vaccination rates per 100 population or anything like that. So if I've misunderstood, just correct me on that. My other question for I guess Minister Hajdu, I didn't hear a clear answer to my colleague's question earlier. So perhaps you can address this. Are you ruling out eventually an inquiry that is actually public, a public inquiry? You were asked about Mr. O'Toole's call for that today. And so I'm not looking for whether there's a departmental lessons learned or an internal. I guess I'm asking, is this government prepared at some point post-pandemic, as you've said before, to initiate a public inquiry into its pandemic response?
Well, thank you very much. And I think both the Prime Minister and I have been very clear that a full investigation of Canada's pandemic response is warranted and required. And we will do that at the appropriate time. And as I've mentioned, we are still in a crisis. And so our focus remains right now on getting Canadians and Canada through this global health crisis, protecting our healthcare systems, Canadians' lives, and Canadians' financial security. And when the time is right, our government will be very open to examining very thoroughly the response of this country to the COVID-19 crisis.
So does full mean public?
I mean, Tanda, listen, I can't predict the nature of the inquiry, but I can tell you that we would want all Canadians to participate. So I will, I will say that we're open to, an inquiry that is as deep as necessary, including a public inquiry that gets to how our country can be better prepared to global health threats in the future.
With CTV. Hi, it's Annie Bergeron-Oliver with CTV National News. My question is for Minister Hajdu. Do you think the provinces are vaccinating people fast enough?
is that we have millions upon millions of doses coming into this country every week over the next many weeks. And of course, all Canadians are anxious to get vaccinated. So I think we will continue, as I said, to be transparent with the doses that we receive into the country, how they're distributed to the provinces, and how they're administered. And I would say that it is important that provinces continue to make those difficult and hard choices, not just about vaccination, about also how to control the spread of the virus so that Canadians can see an end to this ongoing health crisis.
I'm going to try that again because you didn't quite answer it. Your government keeps talking about the ramping up of vaccines starting soon. You just mentioned that millions of doses are going to be coming in every week. Yesterday, Ontario only vaccinated about 76,000 people, and roughly 37% of doses that have been delivered to the province are sitting in freezers. So I ask again, are you concerned that the provinces are vaccinating too slowly? Do you believe that that is the case?
I think that it's hard for me to give you a general answer because, of course, provinces and territories have very different strategies across the country. But what I can tell you is we're watching closely, and we stand ready to assist any province or territory who's having a challenge in rolling out vaccination, whether that be through additional money, as my colleague Minister Freeland announced just a while ago, whether that is practical or technical support, whether that's support to reduce vaccine hesitancy in a variety of different populations, as I mentioned earlier today. But I will also tell Canadians that they will be readily able to get that information so that they can see in their own jurisdiction how many vaccines their province or territory has received and how many have been administered. It's important that provinces and territories continue their hard work, and we'll be there with them as they do this hard work. But of course, Canadians are anxious and they want to get vaccinated, and we know that time is of the essence. This really is a race between the virus and vaccination.
Good afternoon. This is Man Hamidi with the Canadian Press. My question is for Dr. Tam and Minister Haidu. What role do you see the federal government in prodding the provinces to ensure vulnerable workers, essential workers, get vaccinated as soon as possible?
I can speak to this. Thank you for the question. I think it's very important that we understand, as I think Dr. Tam and Dr. New have outlined, that it's not just vaccination that protects vulnerable workers. In fact, we know that even some people who are vaccinated, admittedly only potentially 10%, but there are people who will still get sick despite vaccination. So it's important that vulnerable workers are protected in their workplace from catching COVID-19 using tools of public health. We need safe and healthy workplaces, and that's why our government has been there for provinces and territories with things like essential worker top-ups, with things in like the CERB, like the extension of employment insurance that provides for adequate financial supports for people to take time away from work and not go to work if they're symptomatic and get that essential test to determine if they have COVID-19. We have to remember that vaccination is a very important tool, but it's not the only tool, and that workplaces need to be safe. And of course, that is largely provincial jurisdiction. So it's very important that we protect vulnerable workers, and we do that with a variety of measures. And as I mentioned, the federal government has been there to support provinces and territories to take those steps.
Yes, Teresa Tam, I'll just add that, of course, the National Advisory Committee on Immunization provides recommendations that province and territory have been looking at and supporting. And in this second quarter, this is a phase 2 or stage 2. Of course, there is the need to protect the people who are going to get the most sick, which still remains some of the more senior population. But at this stage, there's also recommendation to prioritize frontline essential workers who cannot work virtually, and they have direct, close physical contact with the public. They can't work from home. And I know that a lot of my colleagues, chief medical officers, and within the jurisdictions are trying to roll out those kind of approaches and also offer vaccines to workplaces that have demonstrated high risk, including that they've had outbreaks. So certainly you can discuss with the province and territories, but I know a number of them have targeted, for example, agricultural work settings, meat packing plants, shelters, and places. Of course, the long-term care homes were the first, but I know that they're looking at those strategies in terms of the current campaigns that they are setting out to do. Some of them, of course, with the data that they have, are targeting geographic areas where there's higher populations with more equity impacts, and they're often essential workers, and mobilizing your mobile clinics and providing information in different ways that these populations need to access information and access the vaccine. So the other thing that we do is try and share best practices at the Special Advisory Committee. So if some jurisdictions have tried certain approaches that worked, they then quickly share with the other jurisdictions as well.
Thank you. My follow-up is for you, Dr. Tam, too. There are signs out of many provinces that the people in ICUs are younger and most don't have any comorbidities that you have that could or would make have made them at high risk. Do you have any data that show how many more infections, how much more infectious and risky the variants appear to be for younger and healthier people?
Yeah, so based on the information I have from the other chief medical officers, many of them believe that what they're seeing is just simply an escalation in cases, and that young people, the proportion of the younger adults that are getting hospitalized is still about the same. It's not that the virus disproportionately is impacting the younger population, although the over the 80-year-olds are still doing well. They're the ones that perhaps are being protected by the initial vaccination rollouts. But increasing numbers means increasing numbers of younger people that could end up in the ICU. And ICU networks and physicians have observed that those increases in numbers. They have not provided any other sort of risk factor analysis at this point. Some of them may have underlying risk factors, but quite a number of them are previously healthy as well. And of course, that puts a lot of strains right now on the ICU systems. The province that has the most experience with the B117 variant, which is Ontario, has managed to provide a scientific analysis of what they're seeing to date, which suggests that, in line with some of the international studies, that the variant cases, B117 predominantly, are associated with increased severity, including hospitalizations and deaths. So that's the best data that we have coming out of Canada at this point.
Abigail Beeman, Global News. With this third wave, with cases rising and some reports of younger people being more seriously ill, I'm wondering if you believe that anything about Canada's strategy needs to change, given that in this third wave, we're also seeing a new level of pandemic fatigue, people who are tuning out, more protests against lockdowns. Does something need to change?
Maybe I can start. It's Minister Haidu, and then I'll turn to Dr. Tam and Dr. New. I think what the increase in infections across the country point to is that everybody needs to make hard choices, and we understand Canadians have been sacrificing tremendously. But we also know that the choices that provinces and territories make now about, for example, what can remain open and what should be closed will determine the kinds of sacrifices Canadians will need to continue making. And so I think Dr. New's three-point plan is a good one. It's about our individual choices. It's about the prioritization of health across the country and making sure that we have a strong, healthy landscape before we make choices about opening or reopening various parts of our economy. And finally, it's about working together collaboratively with the full understanding that it's hard to have a healthy economy if Canadians are not well. It's hard to have a healthy economy if people are afraid of getting sick when they go out. So we have to continue to do this hard work together. And of course, Canadians are expecting us to do it.
Yes, so with younger populations, as I said, is because of the increase in the escalation of the pandemic, maybe increased severity with some of the variants that we're seeing more cases in younger persons. So I do know that there's some very brave young people who've survived the experience with COVID-19 who are speaking out, making sure that their peer groups understand how serious the illness can be, even if these hospitalizations and deaths occur much less frequently than in senior age groups, and increase in understanding that there may be other impacts of being infected by COVID-19, including the current ongoing study of more longer-term symptoms can happen to previously healthy people. Those are just some of the facts that people need to understand. But I think outreach and using different methods to get through to different populations is very important. And so the influences of these different populations and generations we just talked about, whether they be through social media, lead influencers, or content creators, I think they like to be identified as. We've been engaging. And also workplaces, actually. A lot of businesses are trying to do their part in messaging, in providing testing or sort of supporting testing, screening, so testing for screening programs, as well as they are really trying to support vaccinations, getting the message out to their workers who may be young, these working age adults, helping them get to clinics, or setting up some clinics that may be appropriate for workplaces. So I think all of those things can help, on top of supporting people to take some of the time off to get tested and vaccinated. So it's not really a one-size-fits-all, but I think all methods have to be utilized right now to get people engaged.
Thank you.
Dr. New.
Oh, sorry.
Yeah, the only other point I would stress again, and I think it's already been mentioned by Minister Haidu and Dr. Tam, is about, I think, the younger population. The fact that they're now also ending up in the ICUs and being hospitalized, I think is quite sobering. And I think you've seen probably in the last few days, and I think it's even hit me, the level of concern and anxiety, not just public health officials, but also the clinical physicians, the doctors on the ground are actually seeing these folks ending up, in hospital and ICU, previously healthy young adults. So, as we mentioned even earlier on in the pandemic, a lot of, I think, younger folks were probably thinking they weren't personally vulnerable, said, it's just going to be a sort of a mild illness, etc., and so on. And you're seeing now that maybe with the variants and so on, that the situation is changing. So I think that's something we need to build on, and I think there's multiple means. Using Facebook Live events, Dr. Tam and myself were involved with events such as that to try and get the message out. And I think young folks themselves, I think at this point, everyone probably knows someone who's been affected by COVID-19, be it a friend, family member, and so on. And so I think people need to recognize that they need to do their part, but also share stories and show others that no one is sort of immune to the effects of COVID-19. Thanks.
Thank you. My follow-up question is for Dr. Tam. I'm just looking for some clarification on the question of younger people getting sick. I know that over the weekend, Adrian Dix in BC said that while the number of cases of younger people may be proportionately the same, just like what you said earlier, Dr. Tam, he said that the younger people, they're seeing that they're getting more seriously sick than before. So I'm just wondering if you can clarify, are you hearing that from other provinces too, that while the cases numbers may be proportionally the same, that younger people are getting more seriously sick?
Thank you for the question. I think that data is still being analyzed, but it's true that a number of chief medical officers have indicated that what they heard from on the ground is that younger adults, there's certainly increased numbers, but many of them deteriorate quite quickly and have to be admitted to the ICU quite immediately. And then, of course, they spend quite a bit of length of time staying in the ICU, which means that there's a capacity impact as well. So one of the interesting statistics that I presented in my remarks was that the hospitalization rates haven't gone up in a huge way, at least at a national global level, but the ICU admissions have gone up 18%. And that would perhaps be in line with some of these reports, if you like, from the medical officers who are saying that people might be going straight into the ICU very fast.
Hi, it's Tom Parry with CBC. My question is for Minister Hajdu. I just wanted to ask you again about that series of tweets that you put out. And I'm just wondering, in terms of laying out the deliveries versus the doses administered, did you feel it was necessary to do that given the complaints some provinces have been leveling at the federal government at what they say is a slow pace of deliveries? Just what was your motivation for thinking you had to lay out those numbers?
Well, thank you very much for the question. I think the motivation is that Canadians deserve clarity of information, not just about the doses that have been received in their province, the doses that have been administered, but also how to get clarity about how a province is prioritizing populations, and how to get clarity about how they themselves sign up for a vaccination or find out more about how to sign up for a vaccination. So it's really about making sure that Canadians have access to transparent, updated information. We'll be retweeting this information every week so that we can, all Canadians can follow along as provinces and territories do that important work of immunizing their populations.
And the Prime Minister talked about this a little bit earlier, but I mean, are you concerned that any kind of level of sniping between the provinces, the territories, the federal government, that's going to detract from the overall goal, which of course is to get as many Canadians vaccinated as quickly as possible?
Again, the tweets that I sent out last night are factual in nature. They are the number of doses delivered to provinces and territories, the number of doses that have been administered to date, and where Canadians can get information. Canadians expect access to this information. They want to have credible sources of information. We've heard all along that it's confusing, that numbers are, flying out of a variety of different sources. And so we want to make sure as we move forward that Canadians can count on credible information that's updated on a regular basis. So as I mentioned, this information will be tweeted out weekly so that Canadians can follow along in our vaccination efforts as a country.
Thank you, ministers. Thank you, doctors. That concludes today's press conference.